Hi, I'd like to introduce myself. I'm Dr. Fred Williams. I'm currently practicing in Paris, Texas, and I've been here for 25 years. And I'd like to introduce a new novel treatment that we have for postmenopausal women and others, and it's called the MonaLisa Touch. First of all, what is MonaLisa Touch? MonaLisa Touch is a gentle, fractional CO2 laser that's delivered and treats the vaginal and vulvar tissues in an in-office procedure that takes about 5 minutes. It's painless. MonaLisa Touch was developed in Italy and has been out in use since about 2012. There are numerous clinical studies showing its benefits, and I hope that it can be something that might help you. Who can be helped by it? It's designed for women who are having problems with their vaginal health. They're having problems with dyspareunia, which is painful intercourse. Patients who are around menopause and after menopause who are having problems with vaginal dryness and the discomfort that that causes. It's designed for the patients that are tired of having to use vaginal inserts or vaginal estrogen or lubricants, always to help with their sexual health and with their discomfort with intercourse. It's a common problem. About 40 to 50% of women after menopause and around the menopause time have this problem of vaginal dryness. MonaLisa Touch is designed and treats that dryness and restores the vaginal health and can restore some of your confidence and restore some of your ability to have intercourse and be more functional and return it to the fun that it's meant to be. This is an in-office procedure. It takes about 5 minutes to do the actual procedure. It takes about a half an hour here in the clinic to get everything set up and going and ready and done. You can go home right after the procedure. It's painless. We use a topical anesthetic if we're going to be treating the outside of the vagina, also known as the vestibule or the vulva, and that topical anesthetic takes about 10 to 15 minutes to work. And in the patients that we've treated, there is really no pain. I was surprised, I've been surprised, and this is one of those great treatments that's really virtually painless. The interior part, you do not need anesthesia for. It's on a scale of 1 out of 10. It also, for the vast majority of patients, is completely painless. The only minor discomfort is inserting the probe, and that has to be done dry, and it's no bigger than the normal speculum that we use for a pap smear. Minimal side effects. A lot of patients get treatment, get relief, and get some symptom treatment, and get some benefit within 2 to 3 weeks after treatment. We encourage you not to have relations for 7 days until after it heals. There are 3 treatments. They're spaced 6 weeks apart. The length of the treatment, again, is a half an hour, but the duration of effect we've seen to be at least up to about a year after you go through the series. And for next year, for a year out, we plan to do a touch-up procedure that again will take about five minutes to do, and that should help the benefits of the vagina and the vulvar skin. I want to show you a little bit about the MonaLisa Touch laser treatment. I think when we think laser to the vagina, our first thought is of the James Bond movie Goldfinger, where James Bond's tied down to a table, and here comes the industrial strength laser in his package. Not what we're talking about here. This is gentle, this is fractionated, this is a total different game. I want you to fast forward to thinking more like getting your mojo back with the current Mike Myers formulation of the Bond character period, where we're going to use lasers to help things. No, seriously, The MonaLisa Touch is a proprietary laser. It's CO2 laser. It makes little pinholes in the vagina, and over only a small proportion, actually about 10 to 15%, so not the whole thing. And these pinholes are regulated in the duration and depth that they go to the skin. Now, to begin with, we will start with something that's just a beginning treatment. On the first treatment, and the second and third treatment, we'll use the farther depth. The good thing about what this laser does is this laser then makes these little pinholes in this surrounding area around the tissue, then becomes heated. That heat releases a protein which releases growth factors, and these growth factors then stimulate the epithelium, or the skin of the vagina and vulva, to grow and mature and heal itself. Now, this is what a little photograph shows of the little micro dots that it places. This here is a slide of the skin of the vagina, and you can see that it's really thin, and this is the tissue underneath. This is a treatment. This is a slide of the same person who 2 months later has now had another biopsy done, and she consented to a biopsy, and this is the thickness of the skin that's present at the same magnification 2 months later. You can see now that the skin itself is markedly thicker. It's got the folds back that it used to have. Here it doesn't have any folds. See how flat and thin that is. The vascularization is more. We've done slides and stains where we look at the glycogen, and glycogen is a sugar that's produced that feeds the lactobacilli, the bacteria of the vagina, and helps keep it healthy, and helps keep the pH normal, and keeps the pH better to where it's able to tolerate infections better, it's able to tolerate intercourse better, the lubrication's better, the bacterial flora are back to what they should be. So here you can see that there's a little bit of the discharge. We've done other slides showing that the glycogen, or the sugar content has come back to more normal and come back to a more healthy vaginal tissue. Who is a good candidate for this procedure? I think it's really designed for postmenopausal patients who have lost their estrogen. Now, this may be patients that have lost their estrogen from menopause, or patients who are getting around that 45 to 50-year-old age where the ovaries aren't working as well and they're having more problems with vaginal dryness. This is for the patient who's had a hysterectomy and doesn't want to be on estrogen anymore, or for other medical reasons such as blood clots or breast cancer, has not been able to take estrogen. It's for those who have had a family history of breast cancer or estrogen type cancers, and there's some other syndromes, I won't name them, but that can benefit from having some help with their vaginal health. Other patients that I can think of are people who've had breast cancer. Here you come along, you're 40, 50 years old, you've had breast cancer. The vast majority of them now are able to cure. However, as part of your treatment, we've given you an aromatase inhibitor, some anastrozole, those sorts of medications. It's really taking your estrogen level down as close to zero as can be. The vagina suffered for it. You've been cured for your cancer. You're getting along fine. You've got your marriage. Things just aren't quite like they used to be, though. The vaginal health's not like it used to be. Relations are not like they used to be. And this MonaLisa Touch is designed to help that, and to help restore the vaginal health and the vaginal comfort that you have with intercourse. I think this is a big boon. I've been treating patients for 25 years. I think this is something new. I think this is something that has the histologic, the microscopic benefits that are present. It's an in-office procedure. It's relatively painless. it has a very good chance of helping a lot of people. Another class of patients that it's really good for are patients with lichen sclerosis. Lichen sclerosis is a drying condition, a inflammatory, a thinning condition of the outside of the vagina. These patients have never had any really good medications that will work. We've tried testosterone creams, we've tried Vaseline, we've tried steroid creams. All seem to kind of temporize the symptoms, but it never really has the potential to regrow the tissue and help the overall symptoms. This is a potential treatment for lichen sclerosis in appropriate patients. Again, I thank you for listening to this short video. I hope this helped explain some of the benefits of the MonaLisa Touch therapy. I hope that if you would like to, I'd love to have you as a patient, and that you call our office or go to my website, drfredwilliams.com. That's drfred williams.com. There we'll have some more information for you and how to contact us. And again, I'd love to see you and be glad to help. Thank you very much for your time.